Hello and welcome to Public Conscience on Radio, the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society group with a mandate to promote good governance, participation and accountability in Nigeria. I'm Okiri Agbosuremi. I'm here with Adaobi Obiabumo.
Welcome to the program. On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing citizens and government attention for democratic actions against it. We are supported by the MacArthur Foundation.
Today we are continuing with our focus on the dwindling health budget, poor medical services in Nigeria and COVID-19 management in the country. Last week we had two medical doctors on the program, both Henry Ewunonu, and that is the head National Advocacy Committee of the Nigerian Medical Association, and Dr. Ejike Oji, head of the FCT COVID-19 subcommittee, lamented the inability of Nigeria to evolve a wholesome funding system that can stabilize and standardize healthcare delivery in the country.
Regrettably, according to the medical practitioners, over 4 billion naira statutory allocation to the health sector over the years have been trapped due to the lack of political will to implement the law and regulations to get the funds to the health institutions.
This year, and following the financial shock from the dwindling revenue, the federal government cut down on its 2020 budget for the health sector by almost 50%. The health budget, which was initially agreed by the federal government as well as the stakeholders to be 15% of the total Nigerian budget, has been reduced to about 7% of the total budget. In figures, this meant a cut from 44.4 billion down to 25.5 billion naira.
The over 30,000 primary healthcare centers in Nigeria are in shambles. In the words of Dr. Henry Ewunonu, the PHCs are not good enough for the big man's dog to deliver.
And with COVID-19 threatening the world, how can Nigeria provide healthcare services when, as it appears, the healthcare is not a priority? The priorities, as they appear, are allowances and salaries for political office holders, comfort for the president, the governors, and other political office holders across Nigeria, purchase of exotic cars for National Assembly members, ministers, and the maintenance of jets for the president, as well as the award of contracts for the maintenance of the National Assembly. There are fears that a second wave of COVID-19 may be rocking the world, and Nigeria not excluded. We'll be taking a look at how are we going to survive it if indeed we have a second wave that probably would need our finances, particularly now that we have the dwindled budget. I mean, the budget has gone to a low level that you cannot even trust the pulse of the Federation, the pulse of Nigeria with regard to funding to be able to meet up with the challenges. Last week, one of the doctors told us that it cost 1.7 million naira to treat a COVID-19 patient for 14 days. Now, if we have a wave, how are we going to survive that? How are we going to take care of that? Some persons who saw that video have already told us that they don't believe it is not true. They should come up with the details. But that's what he is the chair. He chairs the FCT COVID-19 subcommittee. So, the head committee of the FCT COVID-19, he should understand what we are talking. He understand what the situation is. So if we have a situation where we have more problems, of course, the primary healthcare centers, according to Adaobi's information just now, they are in shambles. 30,000 of them, they are all out there, and we are not able to use them for the benefit of the ordinary citizens, particularly those in the rural areas.
So what happens if there is an upsurge of COVID-19 case in the rural area? How would they manage them?
That is the challenge, and we hope that we can work out ourselves. There are those who are thinking in the government circles, those who would indeed take the challenge of digging deep, like what we were told last week, and that would be the Dr. Ejike said we need to. This is the time for Nigeria to go to the thinking corner and they begin to look how to look at our health. The money that is trapped, for instance, that statutorily ought to go to the health sector, that should go directly to the
over 4 billion.
Yes, over 4 billion that should go directly to the primary healthcare centers and all those things. How should we talk about it? How do we make sure that the insurance cover that we have, we should have for health is working well? The national health insurance, system that we run, how do we make sure that they run? Why are we not taking this COVID-19 seriously, both at the level of the citizens and at the level of the government itself? Why is it that it appears we are not taking it seriously? So, get ready.
Remember that you can join us on our social media platforms at Official Primorg. Primorg is spelled Primorg, and we are streaming live on Facebook at Official Primorg. You can watch our videos on Primorg TV, which is our YouTube channel. Please subscribe to get reminders when we have a new post. And the WhatsApp number for you to send your message is 0902-265-6167. That is 0902-265-6167. That number is for messages only.
Yeah, please, when you send us the message, make it as brief as possible. Let us have your thoughts and go straight to the point. Then we can read those messages out as soon as possible, and we can also get them out even after the end of the program. Please continue to send us those messages. Interact with us wherever you are listening to us, whether you are in Lagos, whether you are in Loring, in Abuja,
or in Anambra
State, wherever you are listening to us, because this is a syndicated program and we are all over the place. You can tell us your feelings, what you think about the management of COVID-19 in your locality. Why is it that we are having an attitude that doesn't support the seriousness that it deserves? We have also raised issues with the accountable process that has been set up. Are we thoroughly accountable? We have brought in BPP here. We have also brought in ICPC to this place, and they have told us all the efforts they have done. The BPP have set up a platform, the Nokopo platform, where all MDAs are supposed to, empty in, file in and update Nigerians. And
as we speak now, there are just 4 MDAs that have uploaded their procurement plan on the Nokopo platform.
Okay, if we have just 4 that have updated on the Nokopo platform, maybe we also take a look at the Open Treasury and how the Accountant General office is also trying to make sure that we have some detailed filing in by the relevant MDAs on how they are spending the money, particularly at this emergency period. So if we have such emergency like we have under the COVID-19, and we have the paucity of funds, Nigerians are generally interested that would be to know if we are using those funds as good as possible, if we are actually employing
for the reasons
for which given to us. And we are glad to tell you that Dr. Aminu Magashi has joined us. He is the coordinator of Africa Health Budget Network. He's a medical practitioner himself. Dr. Aminu Magashi Garba is the founder and coordinator of the Africa Health Budget Network, a regional group that uses budget advocacy to influence adequate health spending and improve transparency and accountability in Nigeria. He's a founding member of the National Advocates for Health, a policy and advocacy think tank engaging in high-level advocacy on healthcare financing reforms. I want to welcome you to the program, sir.
Thank you.
Thank you for finding time to quickly join us on the program. And we're going to go straight into the discussions now. I think the listener out there and those who are also viewing us live on our social media platforms, our Facebook page, they will be wanting to also hear from you. Now let's begin from your general assessment of what we are doing in Nigeria with regard to health. I know your job cut across Africa, but let's localize before we go to the other parts of Africa. What are your takes on the general things we are doing with regard to healthcare in Nigeria?
Thank you very much for this opportunity to engage with the listeners. And you're already aware that already in 2019, around December, the President Buhari signed the 2020 national budget, which also health sector is part of that budget. The budget is supposed to be fully implemented from January this year 2020. Unfortunately, the issue of the COVID-19 came unexpected, and that has also changed the entire landscape and the scenario. So initially, looking at the initial budget of the health sector in the initial approved 2020 budget, we had about 4.1% of the overall budget of Nigeria then was dedicated to the health sector.
The health sector.
So
but the argument was actually that we should manage up the stakeholders. Everybody said, can we take a leap from what we have been doing to 15%?
So unfortunately, that is very difficult, because even the highest sector that took the highest budget was Ministry of Defense, and just around 7%. So there's no way number 4.
And when we talk of education,
that's the
for
point.
26%.
So the defense was the highest that took about 7%. Then education took about 6%. Then humanitarian affairs was even number 3, took about 4.5. Then the health sector took number 4. So you can see it's difficult for health sector to jump to even 15% when it's even number 4 in the.
Even 10% is difficult.
It's impossible, because this is the reality of Africa and Nigeria, and also the initial budget proposal, even before the revision this month, was about 10 trillion naira. But even in that proposal, we are only able to commit 8 trillion for the revenue that will be generated to finance the budget. So even at that particular time, there was shortage of 2 trillion naira, which the Nigerian government, through the Minister of Finance, will have to look for the money through commercial banks, international banks, domestic and foreign
local borrowing.
And that money alone, the 2 trillion, 20%, we have to look for that money. That was the initial proposal. Now with the COVID-19, the budget was revised the last 3 weeks, a lot of rigorous engagement with the National Assembly, the Senate and the House of Rep and the Minister of Finance. So the budget, there was no money. So now the dwindling resources is affecting the entire budget.
What have you calculated to be? Because we are between 5 and 7%. Maybe that I'm too ambitious to say with the reverse budget. Where are we?
So the health sector budget took a nosedive based on the revised budget. The National Assembly, the Senate, passed the budget about 3 weeks ago, and 40% of the health budget cut across capital expenditure
from 44 billion came to 25.
So 40%. So the health sector has 2 categories. We have the statutory transfers.
Yes,
that's the part C of the budget. So in that we had a component of the basic healthcare provision fund. That was just one side. Now that is based on the 1%.
That's one that with the guests we had last week said some of them are trapped up because of political problems. We cannot spend it.
Very good. So that budget initially was 44.5 billion naira in the proposal. So with the revised budget, 40% were slashed. So that's how we were able to come now 25 billion naira. But that is a statutory allocation. So we have to also look at the capital health sector budget, which in the initial proposal that was approved in December had 46 billion naira. So when you took out another 40% of that capital budget, now it's going to also affect other areas of the health sector, like immunization, family planning, global fund, counterpart funding for malaria, HIV/AIDS and tuberculosis, the midwifery service scheme, the money for cancer. So all these were captured in the capital budget. But if you slash the 40% across everywhere, so all the money will now go down.
When we're talking about this, all those sub-heads you mentioned, nobody remembered that nobody knew that there was a COVID-19 that was coming.
Exactly. The National Assembly approved about 700 million naira for cancer. Now the idea was to mobilize money from the private sector, public-private partnership, to procure more cancer drugs for prostate cancer, for breast cancer and cervical cancer. So that money will also be affected. The family planning budget was about 1.2 billion naira in the initial budget. When you remove 40%, we are coming down to about 800 million. That was the money we normally work with the United Nations Population Fund to procure family planning commodities that will be given all over the country to distribute to women of reproductive age. It means that the implication of the budget is also on the services. When you cut down money for commodities, life-saving drugs, money for immunization, money for cancer. So the services will also be affected because there will not be enough procurement and drugs in the facility, and that will also affect the rate of morbidity and mortality for our women, for our children, and all other vulnerable groups in the country. So if you come to the COVID-19, this revised budget has committed additional 500 billion naira as intervention fund for the COVID-19. But that money was not Nigerian money. I want you to understand.
Yeah.
It was in the budget, but it's not really our own money. It's money also from the international commitment. So these are all the issues that the health sector has to, contend with as we move into July to December 2020.
Okay, would like to have your perspective on the relationship between funding and effective management of the health sector.
So the biggest challenge, just to inform the listeners, it's not even about the allocation that we are discussing now. It's the releases.
Yeah, because to allocate is one.
It's one.
To release is another.
The money doesn't come out just by shaking hand or by smiling to the Minister of Finance. The Ministry of Health has to be proactive to get the money out of the finance. It's not easy. So even if,
for example, using the envelope system, because at the end of the day, you have to convince them that what you are asking for is a priority.
Exactly. So even if there's envelope, there's a process to also get money out. The Minister of Health, working with his own directors, has to write an internal memo, to request for a capital budget.
Yes.
Now, this internal memo does not go to Minister of Finance straight. It has to go to the Federal Executive Council for approval. So that process. Now, when it's approved now, then the Minister of Finance will take action. And even at that level, it has to go to the office of the Accountant General. It has to go to the CBN for it to get money. So this process at times could get delayed if the Minister of Health is not proactive. So this will just stay there.
From your record, how much of, so that the listener will understand, let us situate what happened in the last 1, 2, 3 years. How much of the allocation actually became reality during release? What can you tell us about some years you have studied that look, this was allocated, but in reality this was what was released?
So let me give you an example.
Yes, sir.
Let's take the basic healthcare provision fund. So it was allocated in 2018, 2019 and 2020. That's a good example for us to compare now.
Yes.
The basic healthcare provision fund in 2018, 58 billion was allocated and approved. In 2019, 51 billion naira was allocated and approved. In 2020, 44 billion point 5 was allocated and approved. So we can now look at the 3 years. So in 2018, only 25% of the money was released.
Wow. That is out of 55.
Out of 55 billion. So the listener can do all the calculation. Only 25% of that money. So 25% is about 13 billion,
out of
roughly.
Billion.
That was the only money that was released for 2018.
So it's not enough to shout that you have money in your budget.
No.
Let's come to 2019.
So in 2019, there was zero release. You can quote me on that. In 2019, the 51 billion had a zero release within the basic healthcare provision fund. That is it.
What does that speak for us?
So we're not serious. That's the truth. The health sector has money approved by the National Assembly. The money was a statutory transfer. Statutory transfer has more flexibility than a capital budget. It means that money is it's ring fenced, it's protected.
Yes.
But still, we could not, get money
when
out
you
of
say
the
we are not
of
serious,
finance.
what exactly do you mean?
So everybody, that's including myself as advocate.
Yes.
The seriousness, like I said, the money could be there, but there has to be a rigorous engagement within the health sector to really get money. The Minister of Health has to work with the directors and everybody, the permanent secretary, the civil society, the media, to push a memo. This memo, it can stay at the Federal Executive Council without approval. So there has to be a lot of, mobilization, sensitization. We have to amplify the messages.
Tell me, do we need, for a priority area like the health sector, where we know that we really need to get serious, let me use your word, get really serious, don't we really know what we need? If you go to the hospitals, and you are a medical doctor, so I don't need to explain to you. I don't know how many hospitals of the, let us use Abuja for example, how many of the district hospitals have dialysis centers for kidney patients?
Yeah.
Some people are referred to Kano.
That's true. And even those that have the machine sometimes
Yes.
will not be
Pack.
working, or the my machine is working, there's no reagent. So you have so many.
So do we need these protocols? Why don't we design something? Because our guest last week actually said the same thing, that the political bottlenecks and all these things prevent us from really doing what. Is it not an area that we should streamline and begin to say this is a priority? We cannot begin to wait for the thing to degenerate, for people to die before we begin to do something. So how do we address this area?
Basically, if you look at the budget, cycle, like I said, sometimes the Minister of Health has to struggle, with the competing priority of the country. Humanitarian affairs, I'm sure is a key issue in the country. The insecurity is there, the defense, the police, everybody. So the Minister of Health, he has to understand the nuances of even internal advocacy. If you are a minister, you need to be also an advocate within the system. Otherwise, the system, when you go to the presidency, everybody is busy with his own agenda. So you, as a Minister of Health, you need to have your agenda, and you also need to work with the stakeholders. Like I said, the Minister of Health submits a memo. He can tell the NGOs, hey guys, I have my memo in the presidency. Help us to
the question
push this agenda. Can't
we do something that is simpler than what we are doing?
We can simplify.
Yeah,
I agree. We can have what they call the first line charge. So some countries, when you go to some countries, they have like some capital budget, they are first line charge. Once the money is approved, that money is completely taken out of the government account and placed in the dedicated account. So this is where you have seriousness and dedication within the system. Unfortunately, in Nigeria, you have to struggle. When you go to the state level, the health sector is suffering in the same way. The reason why people don't know, because they are hiding in a corner, at this, nobody knows what they are doing. But
because they also have federal hospitals to attend.
Exactly, they have federal medical center, so they can hide. But many of the states, they are already slashing the health sector budget. Now, some of them 30%, some will tell you 40, some 50. By the end of December, some of the states will not able to release 5%. I must tell you, analysis has shown that in 2019, 2018, 2017, some state government were not able to release up to 5% capital budget. That's a disaster. How did they survive? They survive with handouts. So we beg the international donor community. That's how the states, some of them, are actually surviving, because nobody is reporting them, as we are reporting the national level. So a lot of things goes wrong, and nobody is trying to track and ensure accountability and transparency.
Okay, now it's been established that the budget has been reduced. What impact will this reduced budget have on the management of COVID-19 in Nigeria?
So the COVID-19, because of the support that we are generating, from the international community and also from our own, private sector. We are aware of the business community through Aliko, Dangote, and other partners. They mobilized about 25 billion naira to support COVID-19. The intervention fund I mentioned to you earlier, the 500 billion naira was injected into the budget to also support the COVID-19 pandemic. Now the CBN has also committed another money for COVID-19 intervention. That is, they are looking for investors in the health sector that could do research for infrastructure and maybe for vaccine. So by and large, we could say that if we are an organized country, there is a lot of money for COVID-19 right now. Do you get my logic?
Yes.
If we are really unorganized and transparent, for to declare all our income and support we are getting all over the place, we could say there's enough money for COVID-19. What we need to do is to organize and coordinate our response so that to mitigate the impact of the COVID-19.
Now, what line of being organized will you recommend?
Yes.
As somebody who's practiced and you have seen the management, how should we be organized?
So one area, I'm sure you're aware, the threats from the resident doctors, going for one strike. We're happy they are back, but the problem is not solved. Even though they are back, we beg them to come back. The country begged them to come back to work. But the issue that they raised was not addressed up to now. They are talking about the personal protective equipment.
Yes, the
Which
PPE.
is
PPE, and it's mandatory. You can't expect a medical doctor, a nurse, a lab scientist to be attending to patient in this crisis without being properly protected.
Meanwhile, if we use the funds we have,
Exactly, because if that person falls sick, now the sickness is going to have escalation in the community. The person, a doctor, a nurse, falls sick, so she cannot attend to 10 people or 20. Those people go back to community and they begin to have high infection. So it means we have to protect the medical environment. So this is the coordination we're saying.
Okay.
How could we have so much money for COVID-19 and we don't have the personal protective equipment? That means something is wrong somewhere.
Yes.
So we need to really coordinate. The federal government need to coordinate with the state government, because the centers that normally take sample and do the test, they are owned sometimes by the state government. The molecular labs, what the NCDC does is to go and activate and ensure that there is compliance with the national guideline, but the centers are owned by the state. It means the state government and the federal government, they need to work together to ensure that every medical personnel has personal protective equipment, not only one, because a lot of them you need to recycle them. Some they are disposable. It means at every point in time, people, you can imagine somebody has gone to community for contact tracing, and a person that needs to be taken to the isolation center. The people that are chasing this person are not properly protected. So what are we talking about? They are going to get infection in trying to carry somebody from the community to the isolation center. This is the issue that we need to
And you also talked about, there was a line of thought there which also rang on my head, and that was transparency. You are a development person, even though you are a doctor, you are more into development.
Yes.
You understand the monitoring and evaluation. When you are talking of transparency in the management of the health sector and the COVID-19 in general, what is lacking?
So is the in a simple way, is the openness of the information. So in transparency, we need to have the information, we need to also understand the information, we need to act on the information. That's the complete cycle of transparency. Now if we said we are injecting 500 billion naira of COVID-19 intervention fund in the budget, what are they going to do with the money? That's the transparency in a simple way. Tell the Nigerian people what are you going to do with your 500 billion intervention fund. If you say CBN is going to commit 100 billion naira to support infrastructure development, research for vaccine and everything in the health sector. Now let there be guidelines and also openness. Where is this money going? Who are the manufacturers that are going to manufacture? What are they going to manufacture? If they manufacture it, how are they going to disburse this free of charge, or is it by subsidy, or people are going to pay? If we mention the private sector has contributed 25 billion naira, where is the money going? That's the transparency. Is it going to CBN account? Is it going to a commercial bank? And how is that money moving from that bank to the service delivery? So the transparency is the most simple thing any government can do if there's a sincerity of purpose.
And I will add,
Yes.
if the cost of spending the money, it's not enough to just have a tabulation of where we are going to spend the money. We have said at the level of Primorg, and we have also written to all of them,
Very
the
good.
presidential task force,
Very good.
the ministers, we have written to all of them, including the ICPC, to help us monitor.
Very good.
You also need to tell us, what are you buying?
Exactly.
Because when you are spending the money, tell us what exactly did you buy. If you say you bought 200 PPEs,
Yes.
what brand?
That's true.
How much was it?
That's true.
Who bought it from?
Why
Who
is
are the
going?
contractors?
Contractor, very
This
good.
make a whole lot of things. That's why I was interested in the transparency. That
It's important, and even within the presidential task force that you just mentioned. So is there transparency also in that structure? So these are all issues we need to interrogate as Nigerians. When you have a presidential task force that everybody is government employee, what do you expect? There's not going to be any transparency. Everybody in the presidential task force, apart from one development partner that was invited, the WHO, everybody is a government employee. So how could that committee enforce accountability and transparency?
Wow.
So you need to have a committee that is mixed, a multi-stakeholder and multi-sectoral. You have the government employees, you have a rep of a civil society, a rep of a media, of a labor union, and so many other constituencies need to be
independent doctors.
Exactly right. They can now, within the committee, they can also ensure transparency and accountability.
What role would you assign in terms of the management of the COVID-19, the small fund that we have for our healthcare, and the accountability we are talking about? What role will you assign to the citizens?
So we need to ask the right question. because we have to differentiate between activism that we are shouting everywhere and advocacy. So I'm expecting to see a lot of people in the social media. They are asking the right question and asking the right people. Because if you keep shouting, then the people will keep enjoying the money, and you don't even know they're enjoying the money. So we need to engage the governors to commit how much they are collecting from everybody on COVID-19. We need to ask the presidency, the presidential task force, the Minister of Finance, the Minister of Health, how much loans have you collected? Where are these loans going? Who is going to benefit? Where is the independent verification team that will now ensure accountability? So we need to ask the right question. We need to target the right people. We should not get tired of raising question. Of course, whenever you raise question, there is tension. So me that I'm doing budget work, I'm always in the tension with so many people. But we have to keep doing this. This money does not belong to Minister of Finance or the presidency. The money belongs to Nigerians. So we have to ask the right question always.
And ask the right people.
And we should not get tired of raising those questions.
Okay, I believe that you have questions to ask Doctor. Versatile, very strong in his areas of expertise, and he can be engaged by us in the studio and by you. And if you also have a contribution to make, you want to tell us how this thing is impacting on you, what you think should be done, what is happening to the health sector, and we are not restricted to the federal government. If you have information from the states, let us also know. Let us have a discussion that will be robust, but please let us be civil. We don't want to, like you said, we should ask the right questions and put it to the right persons.
We'll be speaking with Dr. Aminu Magashi Garba. He is the coordinator of Africa Health Budget Network.
Let's take this call. Hello.
I'm Muyiwa Kelly, calling from Newton.
Thank you, Muyiwa.
I listen to your guest on the radio. I just wonder, why is it difficult for an average politician in government to simply do what is right for the people? If we say governance is for people, I think not aware of the fact that people are dying for just as simple as 500 drugs in the hospitals. I keep wondering, if we budget for health sector and we can't get the money released, then where is the money? Where is the money? Hello?
We are listening to you. Go ahead. We are waiting for you to conclude.
Where are they keeping the money? And the person who is keeping this money, is he a Christian or a Muslim? Because we talk about God so much in this country, and we still cannot do what is right. People are dying. Look at the scenario. People were asked to stay at home to avoid being infected, and the federal government is not thinking about how to take care of these people. But there's no provision for what happening, and there's no job. Factories closing down, businesses going down, price of stuff going up.
Okay. Thank you very much.
People are dying, like you said.
Yeah, and I think our guest is capable of answering, because I think he answered it partly, that budget is different from what is released. Now, the factors that will make monies to be released fast is what he has explained, that the ministers and his team must be up and doing. They must know when and how to apply all the memos that are need to be written. Hello.
My name is Dr. Bradford Ahubuya. I'm coming from Abuja.
Thank you so much, Doctor.
Yes. I listened to the man on the studio, and I feel so bad that the way things are being done in the country. And however, I think there's a need for the citizens to rise up to ask questions. What is happening? Because as it is now, the epidemic is rising. We're over 20,000 of cases in the country. And why is it rising? Because there's lack of aggressive community education. The area we have put the money into is to area community testing. And these are not been done. And that's why the cases in the country is rising. And if nothing is done, we'll be in trouble in the next few months. And that will be the lead in Africa. So I want to support the man on the student that is saying the right thing. The need for we to properly investigate or ask where is this money, how is it being used, and all that. That's one contribution. Thank you very much.
Thank you so much. Thank you so much. Of course, it's a very, from what the guest has told us here, it appears it's more technical than many citizens will believe. And like the caller also said, we need to play our own role. Hello, your name and where you calling from, sir?
My name is Engineer Uche. I'm calling you from Warempa.
Engineer Uche, go ahead, please. Let's try and do it 60 seconds.
Yeah, me, I'm thinking, if we have all these best friends, like your guests in the studio and many others, why can't the government feed them out to come and help us fix the country? Thank you.
Thank you very much. So many good brains around. Obasanjo did it, fished around the entire world looking for the best of brains. But unfortunately, what we have now is, where are you from? Hello, welcome to the program. It's Public Conscience, and we have a guest in the studio. Your name and where you are calling from?
Yes, my name is Anthony Denya. I'm calling from Provincial in Abuja.
Yeah, Anthony, thank you. Go ahead. Please take 60 seconds, please.
Okay, I Anthony Denya from Korodu in Abuja.
Go ahead, please.
Yes, in terms of budget and relief, what I'm thinking about is the doctor has been talking about lobbying and making advocacy to the right people so that releases can be made. I keep asking myself, before any approval is made, certain procedures and processes are employed. People provide and supply work plans, and this work plan carry out specific activities that this money will be allocated for. And then work plans are approved and budget is approved, waiting for releases. I do not see on my part why certain level of lobbying should go on again. If you approve money for anything to be done, why don't you release the money for what is supposed to be done? Because people have utilized the work plan, and I guess even the Federal Minister of Health, like many other MDS, do the same. If money is approved for that, why shouldn't it be released? Why must I go? There should be some institutionalized system where, whether I love you or not, that this money is released to carry out the activities. Whoever is at the head of affairs. That's my take. Thank you.
Thank you. Maybe, Doctor, you want to respond to that? If the budget is made, I know that there's difference between allocation and release, but he is saying, look, if we have already made up our mind, and I also emphasize it, when we want to renovate the National Assembly, we don't have problems. When we want to buy cars in the National Assembly, some persons don't want me to talk about this, but it is necessary. When we say all the members of the National Assembly will spend 5 billion to buy all their cars, we don't have any problem. We don't have any problem on recurrent. We pay salaries. We attend all conferences. We don't have problem paying allowances. 14 million to the senators every month. Why is it that we are lazy in releasing money for the capital, those ones that we actually need, particularly health?
So those people that raise a lot of questions, those were genuine questions that we need to continue to interrogate in Nigeria. Now, in doing advocacy also, you have to be a realistic person. What is doable and what is not doable within the National Assembly? We believe in the health sector and development work, we have to do more work. This is what we started right now. We believe we have to ensure that do we have champions within the National Assembly that can speak for the health sector. So it won't happen. Yes, I have a friend in the National Assembly. So I was telling him, yesterday you're a wheelbarrow pusher. Today you're a National Assembly. Yesterday you are just maybe a better medicine store attendant. Today you are a senator. So now these people that moved to the National Assembly, they are not technical people yesterday when they were just ordinary people. They are just ordinary. They are just like us. So now when they enter the National Assembly to supervise our budget and ensure oversight function, they cannot do it without capacity building. Even we need to also be proactive to empower them, to train them, to change their own mindset. That this is not about the 14 million you are collecting every month. This is not about your 10 million housing allowance or furniture. This is about service to your country. So I think we need to begin to change the paradigm. We also that we believe in the health sector and education. These sectors will not work if there's no proactiveness. I must be, very frank to Nigerians. We should not expect to see good things in the health sector. The mortality going down, children are being immunized all over the place. There's transparency and accountability. Some people need to step in and take leadership and become part of the process to actually change things in the country. The issue of releases also. Somebody that asks, now this money is in a pool. He needs to understand that when you have, for example, now in 2020 budget, 32 billion is approved for immunization. That money is in a pool.
Not like it's set aside.
Exactly, it's in a pool. So it's not when you have another 1.2 billion naira for family planning. They are in a pool of all this money. They are in central bank.
Same location where you have money for
renovation.
For
exactly, they are there. So that means some people need to really be proactive to get it out. Then the money will enter.
Do we need this lobby? That is the question one of them have asked. Do we really need, if we say we need, yes,
exactly.
Immunization is not something that we want to.
It's for ordinary children. That's the point.
And that's how many primary health centers?
Exactly, 30,000 exactly. So he needs to understand the politics of advocacy. The immunization is for ordinary Nigerians, ordinary kids,
not for senators.
Exactly,
not for presidents,
that is the point. So they will not spend a lot of time trying to really pursue it unless they are empowered to see that when you empower the ordinary people, it has a public good approach. General collective wealth, because if you empower them, then they go to school, they are educated, they will provide service better to the country. If you don't empower them, they become the street children, they become the bandits, they create the insecurity. So it's more productive you protect the ordinary citizens of Nigeria, because when you do that, you are also empowering the entire nation. This is the kind of discussion we need to be having with the National Assembly. They are our friends. Let's engage them. Let's work into National Assembly and engage some people that we believe actually listen. The committees, yeah, you're very right. The Senate committee chair is a medical doctor. The health committee chair, Dr. Sununo, was a former NMA, Nigeria Medical Association, ESCO. The Dr. Ibrahim Olorogbe, the Senate chair, was in the civil society like you and I stand down talking. Now these are people that already. So we should work with them.
And the two big men in the Ministry of Health are both doctors.
That's the point. So we should work with them.
They are
doctors. That is the point. So we should work. The NMA should be having a dialogue. There's time I was talking to the former NMA, national chairman. I said, you need to change your mindset. The NMA is not only about doctors and salary and allowances. No, the NMA should be a think tank that also provides solutions and answers to the health sector. Engages everybody that you believe can help to improve the health sector.
Okay, let me quickly ask this. There are over 30,000 primary healthcare centers. How can these centers be used in the management of the COVID-19 pandemic?
So there's two things they need to do. They need to renovate them to become a little bit okay. Not really. Bring them to and basic things. Ensure there's light. There's water.
One of the doctors last week said, if it's a member of the NMA,
yes,
that no big man's dog will deliver in some of the.
That is true. You're right. So you go to a primary healthcare center. There's no water. How can you address COVID-19 where you can't even wash your hands? There's no water, there's no soap, and there's no source of water. When you go to secondary facility in some states, the water vendors, people could not. When I was telling my people, some people outside Nigeria, they couldn't believe it. I said some secondary facility in our state, they are getting water from the water vendors because there is no surface tank. There's no borehole, there's no solar energy to power any borehole. These are the things that will address COVID-19. So to answer your question, the governors must provide basic water, sanitation and hygiene services in our primary healthcare centers for them to work and respond to COVID-19.
We have to go now. Because if we wait, we are not going to end up this program and we'll run out of time. Public conscience is to prick the public conscience, mobilize the citizens and the government into action, ask the relevant questions, and then we also follow it up by holding advocacy talks with the relevant people. If you have to interact with us, continue to interact with us, provide us all the information. And that'll be, we just have to go now.
I want to encourage you to visit the news page of our website, which is news.primark.org, For all the details of our reports and interviews, visit our website primorg.org to get all the information about Primorg.
And we appreciate Dr. Aminu Magashi Garba, a medical practitioner and coordinator of African Health Budget Network. We want to appreciate you so much, sir. Thank you for joining us on the program.
Thank you very much, too. Thank you.
And Public Conscience is supported by John T. and Catherine D. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the MacArthur Foundation through their website, www.macfound.org.
Join us again next week for another interesting episode of Public Conscience on Radio. I am Adaobi Obiabumong.
And I am Okiri Agbosu Remy. I want to remind you that if you keep your health, give your health a priority, and you stay safe, it will be a community safety you are pursuing. We will all be safe if each and every one of us remain safe. COVID-19 is real, and we must not joke with the fact that some people say it is not real. Let's stay safe, and next week when we come back, we'll be healthy enough to have another episode of the program. Okiri Agbosu Remy is my name.